right, my name is Braden Funky, and this is an introduction to counseling. So, the first thing to discuss when we're introducing counseling is defining what counseling is. So, counseling is often interchangeably used with the term therapy, and it is referring to the process of learning to be aware of one's troubling thinking patterns, feelings, and behaviors, and managing them. And that is according to the National Institute of Mental Health. Now, this process does occur typically with a mental health professional or a psychologist of some kind. And it is just as the National Institute of Mental Health described. It's a process of making a client aware of any troubling behaviors or thinking patterns that might be developing or have developed within themselves and helping them kind of understand them. Furthermore, the American Psychological Institute Association, defines it as a process where a psychologist uses different techniques and theories to help people improve their well-being, alleviate distress, and increase their ability to function in their own lives. And again, I thought that put that very succinctly in just describing that it can also be a process where counselors in either a group or a one-on-one setting work with clients to not only make them aware of their troubling thought patterns and behaviors, but help them correct them and help them deal with these feelings in a constructive way. A very succinct way I've heard it put before is you're making the unconscious conscious. And that's something I've heard in several classes up to this point. But I think that just puts it really well in a nutshell, working with a therapist to make that unconscious mind part of your conscious mind. So when we're discussing and defining counseling, we have to look at what the issues that new counselors going into the field face. And some of these issues are very common. We're going to discuss some of these here and how you deal with them. And someone who may be looking to get into the field of counseling should be aware. Some things they should be aware of it is. And the first thing is they should be aware of dealing with anxieties or handling their anxieties themselves. It's important as a counselor to have a confident identity and be someone who's very assured in themselves. And so having anxiety at the start, although it's totally okay to deal with, it's something that, you should be consistently working on it and trying to, make sure that you feel confident that you're not struggling with these anxieties the whole time, and feeling confident in the counselor that you are. And part of being confident is having that self-disclosure. A lot of beginning counselors are very stiff and won't open up to clients. And it's very important to develop a therapeutic relationship early on with the client. And self-disclosure is a very important part of that, being able to be, someone who discusses themselves, not only just the client with the client. Furthermore, new counselors have to avoid perfectionism. They have to accept that they aren't always going to be perfect, that, that they're not always going to give the exact right advice or, thing to say in that moment. They're not maybe going to use the right theory at the right time. They just have to accept that mistakes are going to happen, and that's totally a human thing, and it's just part of the therapeutic process. And so it's not a big deal if mistakes happen. Furthermore, counselors have to be honest about their limitations. They can't expect themselves to force a client to do the work that they need to do. Counselors have to be honest with themselves and accept that there will be limitations to what they can do. Furthermore, lots of new counselors struggle with silence and understanding silence and being able to work with clients through that. Silence is something we as humans try to fill, but it's important for counselors to, sometimes give their client the time when they need to think or, mull over something a little more. Furthermore, new counselors struggle with demands from clients. More experienced counselors are able to set those demands into two camps of demands we can work with and demands that are maybe unreasonable. New counselors have to be able to do that themselves, and that's something to kind of struggle with at the start. Furthermore, new counselors also might struggle with clients who lack commitment. If they're court ordered to attend therapy or something like that, they might struggle with the commitment of actually coming into counseling. Furthermore, tolerating ambiguity is one of the big things that beginning counselors struggle with, because it won't always feel like therapy or counseling is working. But the more experience you get, the more you're going to trust the process and the theoretical frameworks that you're using. That if you keep doing them, they are going to be effective. More problems beginning counselors face are being aware of countertransference. Transference is the process where a client projects onto the therapist, and countertransference is when a therapist is projecting onto the client. It's usually associated with some sort of emotional thing going on outside of therapy, whether it happened in the client or the therapist past, or if it happens occurring to them in the exact present. But being aware of countertransference and being aware when you as a counselor are projecting, counter-transferring onto the client is something just you have to be aware of as a new counselor. Furthermore, you also have to develop a sense of humor and be able to joke around. You can't be so stiff all the time as a new counselor. It's important to have a laugh occasionally. Furthermore, you also have to share responsibility. Counseling is a two-way street, so to speak. You have to share the responsibility and work with your client. And you can't just have all the control all the time. It's very important for counselors to hand some of that control to the client. Furthermore, you also have to decline to give advice to your client. You're not just giving them sage advice. You're trying to help them develop strategies to handle things for themselves, and become independent and be aware of their own thinking patterns or, behaviors. You also have to define your role. Lots of beginning counselors have trouble defining their role within the theoretical framework that you're using at the beginning of therapy, but it's very important to just from the outright give yourself a strong identity and the role that you're going to be playing in the therapy and the theoretical framework that you're going to be using. And so, it's consistent early on. Furthermore, you also have to use techniques appropriately when we're talking about theoretical frameworks. You have to know when to use certain techniques at certain times and use them effectively. And furthermore, you have to develop your own style. Each therapist is going to be different from the next. Certain counselors are going to use different frameworks. Other counselors are going to use other ones. You just have to develop your own style and be confident in that. A lot of new counselors struggle to do that early on. And then finally, lots of new counselors struggle to maintain their own vitality. You have to participate in a lot of self-care as a counselor and be a vibrant person who presents a lot of energy and is enthusiastic to help all of their clients individually each day. And that's something you're striving for throughout time. And a lot of new counselors will struggle with that. So when we're talking about the things that new counselors struggle with, once those things are handled, so to speak, we start to look at what makes an effective counselor, what makes a counselor good at their job. And the first thing, which we talked about previously, there's some overlap on this slide with the last, is having an identity. You have to be very confident in who you are and who you are as a counselor and the strategies you use. And having an identity is a big part of that. Furthermore, you have to respect and appreciate yourself. I feel like that goes hand in hand with identity. You have to have a strong, confident sense of self. And furthermore, also be open to changing that sense of self. As a counselor, you're trying to help clients change. And so if you yourself aren't open to that same change, it's imperative that you're able to do that, in your own life. Furthermore, you also have to make choices that are life-oriented. You can't just accept existing. You have to, make choices that make you a vibrant and lived-in person, participate in self-care, that sort of thing. Again, we talked about that previously. And then a big one here is the authentic and sincere and honest counselor, be one at least. And when we're talking about this, we're talking about building a therapeutic relationship by being open, by being someone who is willing to self-disclose, by being sincere and honest, and just being someone who clients can trust and open up to. And as a result, when you build that relationship early on, an effective counselor is going to have their clients be more open in return, and therefore the counseling is just going to be better overall for everyone. Furthermore, you also have to have a sense of humor as a counselor. You have to be able to laugh at things. We talked about that on the previous slide. And then furthermore, you have to be willing to admit mistakes, which is, again, a thing we discussed previously. Furthermore, effective counselors have to live in the present. They can't get caught up in the past with their previous mistakes and things like that. They have to know what they have to do in the moment and, work on that at the time. Furthermore, effective counselors appreciate the influence of culture. Effective counselors are multiculturally aware, so they know lots about different other cultures and how the people from those cultures act. And if they encounter someone from a culture that they don't know, they're willing to ask and learn about that culture in order to provide a more effective counseling service, and help that person through their issues and discuss things in a more open way. Furthermore, effective counselors have an interest in the welfare of others. If you didn't have an interest in other people getting better, you frankly wouldn't be a very good counselor. And then you also have to have effective interpersonal skills, which relates to, that authenticity aspect of things. You have to be able to be a person who clients want to open up to. Furthermore, you also have to be deeply involved in your work and be passionate. You have to be someone who approaches counseling and therapy enthusiastically and wants to help clients genuinely get better. Without doing that, you're going to seem fake, so to speak. And then finally, you have to be able to manage healthy boundaries. So as much as you're passionate and as much as you're deeply involved, you're very clear-cut about the boundaries of, I'm the therapist. In these settings, I'm here to help you. I'm not your friend. We're not going to create multiple relationships. And so you just have to set that out very clearly, and effective counselors will do a good job of that. Finally, when we're introducing counseling and what it is, we have to discuss the therapeutic relationship, which has kind of been a recurring theme so far. And so the therapeutic relationship is that relationship between the client and the counselor, that relationship of trust, that relationship that, invites the client to, open up to the counselor and help, in turn allow the counselor to help them, correct any troubling thought patterns or behaviors they might be having. So to develop that therapeutic relationship, we need several skills. And the first one is to be open, accessible, and collaborative, which again is something we've talked about previously, but it's just so important in developing that therapeutic relationship. And in order to make therapy successful, we have to be open, accessible, and collaborative. Furthermore, we also have to be a good therapeutic relationship and to be an effective counselor. We have to be honest and have non-stereotypical qualities about ourselves. You can't be a counselor who hides behind their degree, so to speak. As a formal suit and is very high and mighty above their clients. You have to be very approachable and down to earth. And that relates to the next point is lacking in ego. You can't be high and mighty above the client, holier than thou, so to speak. You have to be down to earth, approachable, self-disclose, have a laugh occasionally, just be very human, be authentic. This is very key to, building that therapeutic relationship. Again, talking about being approachable and adaptable, you have to be willing to change in the moment, use a different theory, use a different method to get a client to open up. Maybe a client's more humorous, maybe a client is a little bit more mushy-gushy emotional. You just have to know how to get into different people's thinking patterns and adapt yourself to those social situations in order to get them to open up to you to provide effective therapy and be in that good therapeutic relationship. Furthermore, we talked about this previously. You have to have that strong therapist-client boundary. I'm your therapist. I'm here to talk to you in these settings. I'm not your friend. And then furthermore, we talked about this previously, being multiculturally aware and being flexible in that identity of, knowing about different cultures and willing to learn about new ones that you might encounter. So again, theoretical knowledge, very, very important to, understanding and working in counseling, but that therapeutic relationship, some research has even said that it's more important than that theoretical knowledge. But overall, I hope this was an effective introduction to counseling. These are my references, and I'd like to thank you for the time.